Kerry McEwan, who already comes from Scotland. She is the chair of the General Medical Council of United Kingdom, and she is also the consultant ophthalmologist at the Tayside NHS, as well as the honorary honorary professor to the University of Dundee. She was appointed as the Dame Commander of the Order of the British Empire for the services to ophthalmology and healthcare. Leadership during the COVID-19 response in the Queen's Birthday Honours List in June 2021. She will speak to us on building trust between regulators, clinicians and the public. Over to you.
Thank you very much for that kind introduction, and thank you everybody for giving me the opportunity to be here to join you to celebrate 100 years of the Sri Lanka Medical Council, and amongst such auspicious company. I bring warmest congratulations from all of the General Medical Council on this momentous occasion. And it's a huge pleasure to be here with you. And I've enjoyed what we've had so far. I've really enjoyed the presentations, and I know there's going to be more rich discussions to come throughout the day. As already mentioned, I chair the General Medical Council, and that is the UK regulator of doctors. And until 6 months ago, we only regulated doctors, but now we've been given the responsibility of regulating physician and anaesthesia associates. So my job today is to talk about trust and why trust matters for regulators, for clinicians and for the public, and how that can make or break the relationships that are vital across all three of these groups. Trust at its most fundamental level is about the bond between individuals and those individuals and the institutions that shape their lives. It's an incredibly precious commodity, and one that once lost is hard to regain, and it needs to be constantly tended to and topped up. In today's internet-enabled age, when the currency tends to be outrage, falsehoods, whether intended or otherwise, these are disseminated with ease, and that makes trust all the more fragile. In fact, more so than at any time I can remember, there is this prevailing cynicism that means those of us in positions of responsibility have to work even harder to win trust. But it's absolutely vital that we do. And the reason for that is that without trust, doctors can no longer have meaningful relationships with their patients. Patients can't have confidence in what their doctors tell them, and regulators cannot fulfil their duty to the public effectively. So fostering trust across all of these relationships is critical if the healthcare system is to run smoothly. But it takes work, and it takes a willingness to recognise when that trust is lacking, why this might be happening, and how we can take steps to restore it. As doctors, the great privilege of our profession lies in a patient putting their health and sometimes even their lives in our hands. Sometimes sharing with us very private and personal information at very short notice, and permitting us to use our skills to make a difference to them. And some of these skills involve uncomfortable and invasive procedures. These interactions are inherently acts of trust, both precious and essential. But they can also be subject to forces outside our control as clinicians. Today, doctors are no longer the sole gatekeepers of medical knowledge and information. For instance, in my own practice, I've seen how with easy accessibility of the internet means that patients quite commonly come to me armed with their own analysis of their condition. And that, along with that, comes higher expectations over how they should be managed, sometimes just coming to affirm their own diagnosis and to be treated the way they want rather than to consult. That patients feel empowered in their interaction with doctors is obviously a good thing. And the ability to take ownership of one's health is something that most of us would encourage. Rather than being the passive recipients of care, most of today's patients want themselves and their families to be at the centre of decision making and to understand fully what that and how it affects them. And that is a right thing to do. But while that free flow of information has many benefits, it has also opened up a space for what I would describe as actors who lack the education, the training, and the regulation that all doctors are subject to. And social media means that unevidenced, scaremongering, and often prejudicial information can disseminate at an alarming rate. We saw this most clearly during the pandemic, and of course the vaccine hesitancy that's accelerated following this. These are global, epoch-defining trends. What are mere regulators going to do about them? How can we get over this task without it being overwhelming? I believe we have a number of tools at our disposal, and in contrast to the modern phenomenon I'm describing, the answer is perhaps the most fundamental, established one in our arsenal, and that is how we as doctors behave as professionals. In short, it's not just the care that we deliver, but the way we go about doing it, and that is what defines for the patient their experience. It's how we listen to patients, it's how we articulate our course of action, and it's how we show that we care and we understand for them and their circumstances. This is what's often described as soft skills, like listening, empathy. These are as material to a patient's care as surgical skill or diagnostic ability. But while their importance has been increasingly recognised in recent years, there's still a sense that these soft skills are nice to have, rather than being absolutely critical part of a doctor's toolkit. This is something that has to change. Trust is a process that involves action. So like anatomy and physiology, communication and leadership must be core to the medical student's curriculum. This is something that we at the GMC are driving forward in our work with medical schools and healthcare employers within the United Kingdom. Because it not only matters acutely to the doctor-patient relationship, but also the relationship between doctors themselves and their entire healthcare team. A psychologically safe environment where doctors feel free to speak up and to ask questions requires trust between colleagues. Where this is lacking, doctors may feel that they're unable to ask for help or to escalate the concerns that they have. And they may be concerned about this for fear of the consequences because they do not have trust in the entire team. Now this inevitably goes to the heart of patient safety, and it really must be given the risk that it deserves. So what about the role of regulators? Well, we as regulators have a critical part to play in this as well. Our ability to influence is directly linked to the trust that we have with both our registrants and with the public. They need to trust both of us in our work. And we've already heard this morning the two different perceptions between what the public may think of the regulator and what the profession may think. So for patients, they need to be able to trust the regulator to uphold the standards as being a key part of the trust in the healthcare system as a whole. Now this relies on patients believing that we will ensure that the doctors treating them have the correct knowledge, the correct skills, and the correct behaviours. And that we as a regulator will take action if that education, practice, or conduct of those treating them falls short of these standards. But not only that we will do so swiftly, we will do so effectively, and we will do it without fear or favour. And for the profession, the pride of being a doctor is partly driven by the preservation of these high standards and the knowledge that we're working in a field where skill and professionalism matter and are valued. But if the doctors don't trust their regulator, why should they adhere to the standards that we set? Of course, the dynamic between the regulator and those it regulates is often thornier than the one between the regulator and the public, largely because upholding standards means intervening when they're not met. And for the profession on the receiving end of such decisions, some may be critical over the judgments we make and the way in which we do that. Being critical is one thing, and we must listen to criticism, but much more damaging than that is fear. Fear that their careers may be damaged, fear of the impact that any investigation may have on their families, fear of long, difficult processes, and fear of being treated unfairly. Now this matters. It matters because it can have a psychological impact on doctors, and that effect of perception spreads amongst the profession. But what really matters here is that it has an effect on patient safety. Fear is not conducive to good outcomes. Doctors who are fearful may act defensively rather than in the best interest of the patient in front of them. They tend to over-investigate, they tend to over-treat, and commonly they fail to make urgent decisions. So in everyone's interests, we do not want those we regulate to fear us, or, in short, distrust us. And that's why we, at the General Medical Council, have been changing the way that we regulate. And that emphasis is on minimising fear and increasing trust in all involved. So how are we doing this? Well, it's not by being weak and failing to take appropriate action when it's required, but by demonstrably taking action that is visible, it's swift, it's fair, it's relevant, it's effective, and above all, it's compassionate. Achieving this requires an entire shift in the organisation mindset, from the tone that we use to communicate with doctors and to the public, to the speed with which we respond to their queries and complete their investigations. We are pursuing a model of regulation that puts compassion at its heart. Remember, medical councils do not exist to punish doctors or to treat them, but to treat them as professionals and to promote and protect and maintain the health and safety of the public. So that prize, we hope, can be achieved and will be felt when we are able to be trusted. Ladies and gentlemen, nothing in medicine stands still. We've already heard that in our previous talk. And all healthcare is intimately tied to the shifts in wider society. So we need to be responsive in order to constantly adapt and evolve. But whatever the changes that shape and shake us up in medicine, at the heart is the bedrock of trust. Because without it, frankly, all is lost. So across all who provide healthcare, that's regulators as well and patients that we serve, we need to identify that trust is the glue that holds everything together, and it's essential if we're going to share safe, patient-centred care. And I know that from hearing what's happening in Sri Lanka, that things are going to continue to evolve in a way that, reflecting on the past century, we're going to look forward to the next century with hope, with trust being at the heart of that. Thank you very much.
Thank you very much, Professor